In this video, you will learn how to handle and clean tips. Please bear in mind that the information which is covered in this video can also be found in our Safety and Setup Guide on the support website. Dental instruments are classified into 3 categories, depending on the risk of transmitting infection: critical, semi-critical, and non-critical. According to this classification, intraoral scanner tips are semi-critical instruments, and preferably should be autoclaved or alternatively disinfected using high-level disinfectant. All TRIOS tip variants are removable and autoclavable. The TRIOS Standard, the first generation TRIOS, and the TRIOS Color, the second generation TRIOS, had the same scanner tip by design. The difference is in the mirrors. TRIOS Standard scans in black and white, while TRIOS Color enables real color scanning. The TRIOS 3, the third generation TRIOS, has a smaller tip and is available in 2 variants: one with replaceable mirrors, one with fixed mirrors. Before you start scanning with TRIOS, regardless of which variant you have, please ensure that the tip is clean and has no significant scratches. In case of fingerprints, proceed with the cleaning procedure. Stains on mirrors after autoclaving indicate an improper autoclaving process. For example, opening the autoclave before drying was complete. Stains may be removed with a cotton swab and alcohol. If not, you may have to exchange the tip. In case of scratches, you may have to exchange the tip for a new one if it impacts the scan experience and degrades colors in the 2D view. After the scanning procedure, the tip must be cleaned and sterilized between patients to avoid cross-contamination. Firstly, wipe the tip when it is still attached to the scanner. Then remove it and clean the tip manually using soap, water, and a brush immediately after use. Inspect the mirror of the tip after cleaning. If the mirror is stained, smudged, or has a milky haze, repeat the cleaning using a soft toothbrush and soapy water. Rinse with water. Dry the mirror carefully with a paper towel. Now put the tip in a paper sterilization pouch, which should be airtight. Use either a self-adhesive pouch or a heat-sealed one. Proceed with the sterilization in an autoclave with one of the 2 programs: 134 degrees Celsius or 273.2 degrees Fahrenheit for a minimum of 4 minutes, 121 degrees Celsius or 249.8 degrees Fahrenheit for a minimum of 45 minutes. Use an autoclave program that dries the wrapped tip before opening the autoclave. Some TRIOS 3 tips have replaceable mirrors. Before you start doing anything, make sure that you read the instruction attached to the full TRIOS kit box. To insert a mirror inside the tip, use tweezers and slowly slide it into the tip. You can push the edge of it with the tweezers to place it correctly. To remove the mirror, take the tweezers and push the front edge of the mirror, then gently slide it down. Put it in the package and replace with a new one, doing the exact same thing as shown before. Sterilization of the scanner tip is always desirable, but if sterilization is not practical, a high-level disinfection with a high-level disinfectant may be used. The procedure here is almost the same as before. Clean the tip manually using soapy water and a brush immediately after use. A mild dishwashing detergent or similar is recommended. Inspect the mirror of the tip after cleaning. If the mirror is stained, smudged, or has a milky haze, repeat the cleaning using a soft dish brush and soap water. Rinse with water. Dry the mirror carefully with a paper towel. Disinfect the tip using the approved high-level disinfectant for the time recommended by the manufacturer. After the tip has been immersed in the disinfectant, remove it and rinse it according to the manufacturer's guidelines. When done, use a sterile and non-abrasive paper towel to dry the tip. Now you can insert it onto the scanner and start the scanning process. You have now learned how to handle and clean tips. We hope this was helpful. Thank you for watching.